The month of April is dedicated to esophageal cancer awareness, and on this Wellness Watch, presented by the Digestive Health Institute, we're ensuring that we can recognize those signs before it's too late. So joining me this afternoon is Dr. Scott Plain. How are you?
I'm doing well, thanks. Thanks for having me.
Awesome. Thank you so much for joining us and for really shedding light on such an important issue. So first, we're going to talk about esophageal cancer, but
sure.
Show me, where exactly is the esophagus?
Well, generally, it's the swallowing passage that's located between your mouth and your stomach. It conducts food after you eat and chew and conducts into your digestive system. It's in the middle of your chest, basically, anywhere in between your airway or your windpipe in front, and then in the back is the spine. So the esophagus sits in the middle in between there.
Okay, so I know a lot of times before people start diagnosing themselves, we have to know exactly where it is, and that's why we have you as the expert to explain that. But again, a lot of times when it comes to cancer, we don't recognize things until it's too late. So what are some of those symptoms that we need to look out for?
Certainly. I think it's symptoms that persist, not ones that are just very temporary, but in particular, the one that's most troubling and that one that you need to pay attention to is when it becomes difficult to swallow your food. As that develops, people sometimes start to lose weight because they're unable to eat normal foods and they start to modify their diet, and as a result they have less and less intake, less calories, and they start to lose weight. Those are the symptoms that are troublesome, and I think the ones that you should really bring to the attention of your primary care doctor. Okay,
so I like how you brought up the fact that when you start having trouble swallowing food, but how do I know exactly when this is something, might not just be me having a cold, but when do I actually need to turn to a doctor?
Sure, that's a good question. I mean, sometimes people have a cold, they have a sore throat, they have what they call strep throat, and it hurts to swallow and it's difficult to swallow. But those typically will pass and it will improve after a week or shorter. But it's those symptoms that persist and seem to get worse that are the ones that really are the ones I think we need to pay attention to and bring to someone's attention. And especially if it's coupled with weight loss, or you start to feel weak, or you're becoming dehydrated because you're not able to take adequate liquids or fluids. Those are the symptoms that are really, I think, the ones that need to be addressed.
Perfect. And if any of our viewers at home are like myself, sometimes if I start feeling a little uneasy, the first thing I'll do is go into Google and I'll say, WebMD, what is it that I'm doing wrong? What am I diagnosed with? But why is that so harmful?
Well, I think it's helpful, but it also creates some anxiety, and we see that quite often with our patients. But it's those symptoms that continue. It's not the ones that just will go away that are the ones we become concerned about. If it lasts and is coupled with other more significant symptoms, particularly weight loss, pain, things like that, those are the times that we really advise someone to bring that to the attention of their doctor.
Okay, so what are some of those preventative measures that we can start taking?
Well, that's another good question, because everybody's interested in preventative medicine. I think just following a healthy lifestyle, avoiding smoking in particular, well-balanced diet, limiting your alcohol intake, those are, I think, big steps. But one of the other symptoms and problems that we're seeing more and more is that of someone with significant acid reflux problems.
Okay.
A lot of people have indigestion that is very temporary, it's frequent, but the people that have persistent heartburn, those are the people that have the condition that can lead to esophageal cancer. So it's the persistent acid reflux and acid exposure to the esophagus that can trigger abnormal cells, abnormal tissue, and then increase the risk of esophageal cancer. So persistent acid reflux symptoms are another big problem that should be brought to the attention of your doctor.
Okay, so that acid reflux, people who are smokers, are there any other groups of people that are high risk for esophageal cancer?
Those are the primary ones. I think, again, smoking and acid reflux, and certainly the people that don't have a very good diet or have excessive alcohol intake, those are all conditions that would predispose or increase the risk of developing some problems.
So unfortunately, a lot of times people realize these things when it's too late. But walk us through what a visit at a gastroenterologist entails.
Well, we'll be happy to address all your problems. You bring your symptoms to us, and then we need to then create a game plan of how best to evaluate what symptoms that are developing. Particularly, a lot of times we'll involve what we call an endoscopy or a scope, where we put a video camera down with someone is sedated so they're very comfortable, and it's a very safe procedure. We do them at an outpatient surgical center typically, and we will investigate the appearance of the esophagus and the upper digestive tract, and making sure that there's no abnormal cells, abnormal tissue, or some other problem that can mimic what you think could be a real serious problem, but maybe a much more benign problem that has similar features. But yeah, the endoscopy is really one of the easiest ways to address and to assess things.
And that's so great. Thank you so much for just sharing all that information with us. One last question I want to ask you is, do you have any words of encouragement that you can pass along to people who may be going through this right now?
I would say that, again, prevention is really helpful. Making sure you stay on the medications as prescribed by your doctor or your gastroenterologist, and then investigating symptoms that persist. But typically, because it is not as common as other cancers, it's not necessarily something that everybody who has a swallowing problem has cancer. So it can be something else much more benign, and it typically is, but still needs investigation.
All right, well, thank you so much for sharing that and for joining us on our Wellness Watch, Dr. Plain.